morning, Jenny. The first thing we're going to be doing this morning is an oral cancer exam. So I'm going to be feeling around your face and on your neck down to your clavicle. And I'm also going to be looking inside and kind of checking for any lumps, bumps, or anything out of the normal. Is that okay with you?
That's fine.
Okay. So I'm going to begin with the facial nodes. Okay, and right here, they're located up around the nose and the lips. And I'm going to be doing bilateral circular palpations. Okay, and I'm just going to continue all the way back to the parotid nodes and past the parotid gland to the temporomandibular joint. And I'll also be getting the anterior auricular nodes. Okay, and then once I get to the temporomandibular joint, I'm going to ask the patient to open and close while maintaining my fingers on her joint. And then I'm going to observe midline opening and closing for midline variations. I'm also going to listen for popping or clicking. And then I'm going to ask the patient, do you notice any popping, clicking, or pain with your joint?
No.
Okay. I did kind of feel a little bit of popping there, but as long as you're not having any difficulties, that's okay. Okay, now I'm going to continue back around the ear and get all the retroauricular and all the way back to the occipital nodes. Always looking before I feel. So I want to take a really good look. You can't see me looking in the video, but before each procedure, I'm looking. Okay, once I finish that, I'm going to go down and look and palpate the submandibular nodes and salivary glands, which are right underneath here. And I'm going to do that with bilateral circular compressions. Okay. Then I'm going to go down the neck and get all the superficial and deep cervical nodes, and I'm going to follow the sternocleidomastoid muscle as I do that. So I'm going to do bilateral circular compressions. Okay. And then to make sure that I get a thorough job with all the lymph node chains here, I'm going to have the patient tip their chin down and turn to the left. Okay. And then I'm going to also do bidigital compressions, grabbing that tissue and trying to feel for all those lymph nodes on both, all the way down to the clavicle. Then I'm going to have the patient turn the other direction and follow with the same procedure, bidigital palpation, all the way down to the clavicle. Okay, then I'll ask my patient to turn forward, and I'm going to check the thyroid. The thyroid is located around the trachea. Okay, turn it back. I have the patient tip their chin. Oops, I'm on a sequence. Tip their chin down a little bit, and I'm going to visually inspect it, and then I'm going to take and push the thyroid gland in one direction while palpating it on the other side, and then do the reverse on the other side. Okay. Then while holding my fingers along that trachea, I'm going to ask the patient to swallow. Okay. And I'm feeling for any lumps, bumps, or anything out of the ordinary. Okay. Thank you. I'm now going to look inside, so I'm going to have you put your glasses on. All right, so I'm just going to, again, look at everything before I feel it. So I'm going to look at the lips and the condition of the lips, looking for any chapped lips in the corners. Then I'm going to palpate the entire lip area bidigitally. Okay. And then I'm also going to look at the mucosa, the labial mucosa, and then the buccal mucosa, the alveolar ridge, and the retromolar area. And if I could not see directly, I would grab my mirror, but I've got good vision for all of this. Then I'm going to palpate that whole area bidigitally. Okay, and I'm going to get the retromolar pad and the alveolar ridge with digital palpation. All right. Now I'm going to look at the hard and soft palate and inspect that. and the maxillary tuberosities. And then I'm also going to palpate that. All right. After that, I'm going to look in the back of the throat, in the tonsillar area. So I'm going to depress her tongue with my mirror, and I'm going to ask her to say ah at the same time. Ah. Thank you. Okay, and I got a good vision of all the pillars and the tonsils and the back of the throat. Now I'm going to be looking at the tongue, so I'm going to have her stick her tongue out at me, and I'm just going to look at the dorsal side of the tongue. Okay. Then I'm going to have her keep that out, and I'm going to grab it with a gauze. And I want to look back at the base of the tongue. So if I need to again, I'll be grabbing a mirror so I really get a good look at the base of the tongue. It's the common spot to find oral cancers at that base of the tongue. Okay, and then I want to look at the ventral side, so I'm going to have her put her tongue to the roof of her mouth, and I'll have you stick it back out again, and then I'm going to bidigitally palpate the tongue. Okay, now I'm going to check the floor of the mouth, so I'm going to ask her to put her tongue up again, and I'm going to visually look at the floor of the mouth. Okay, I'm also going to be checking the inner surface of the mandible at the same time. Okay, I'm going to digitally palpate the surface of the mandible. Okay, and then I'm going to bimanually palpate the floor of the mouth, which will get us those salivary glands again and nodes. Okay, I've completed the cancer exam, and I did not find anything out of the normal, so there's no further directions.
Good.